You're watching a reality check exclusive at a time when the virus is surging across India, and particularly across India. Something interesting seems to be happening in Mumbai, a city which has long been the epicenter, the hotspot of the virus, has actually started to see cases drop. Daily cases in Mumbai have fallen by 60% in the past 2 weeks, and on the past several days, the cases have either fallen below 4,000 or are about the 4,000 level, which is much lower than many other cities which are seeing hundreds and thousands of cases reported every day. Now, again, with the caveat that it's too early to start calling anything a turnaround or a success, there may be important lessons to learn from how Mumbai is fought and has been fighting the virus. And no better person to explain that than Iqbal Singh Chahal, who is the Commissioner of the BMC, the Mumbai Municipal Corporation. Thank you very much indeed, Chahal Saab, for joining me on Reality Check, for taking the time out. Now, again, as I said, with all the caveats, Chahal Saab, I'm sure you would also not want to start signaling success just yet because we're in a very sensitive situation. But do take us through how, from the time when the virus was soaring in Maharashtra as a whole and in Mumbai, now we've started to see the curve drop somewhat.
Good morning, Srinivas, and thank you very much for providing me this opportunity to present our case to our eminent citizens. You know, our second wave started on the 11th of February when cases started rising, and our positivity went right from less than 3% to 31%. Right. And now we are almost at 78 days of this second wave. And in the 78 days, we have got something like 3.18 lakh new cases. And in this 3.18 lakh new cases, the mortality has been 1458, to be very exact mathematical. This comes to 0.4%. And I'm very happy that the team BMC, specialist doctors in the health management system, could keep the mortality to 0.4%, which I claim to be lowest in the world anywhere. 0.4%. And now the last 7 days, our active cases have crashed down from 87,000 to 66,000 now.
Right. Just a second. So you're saying the mortality rate, that is the percentage of deaths to the total percentage of those who are infected, you're saying is just 0.4% at the moment, which is quite low. But you are seeing, on an average, the number of deaths are veering between 60 to 70 deaths per day. So is that something which you are still a bit worried about? If there's been
no, I'm not worried about. I'll tell you the reason for this.
Yeah.
Initially, we used to have 20 to 30 deaths in the first 50 days. But now, you know, serious patients who get into the ICU, they don't come out at least for 3 weeks, sometimes 4 weeks. And patient who was admitted almost 3 weeks back, he's still in the ICU struggling for life as we're trying to save him. And right now, we have 2,800 such patients in our ICUs of 172 hospitals on my dashboard. So we are trying our best to make them survive, but over a period of time, they tend to increase this figure, although this figure is coming for the last 15 days now, 59, 60, 70. Right. Last evening we had 59. Yeah. But still, all put together, mortality is 0.4%.
0.4%. And your positivity rate at one time, you said, was close to 31%.
Correct.
And currently, I believe it's somewhere in the range of 13%. Is that right?
Yesterday it was 12.5%. Again, today is 12.5%.
Okay, so it's almost fallen by half. Now start taking us, I know there are multiple factors which has brought you to where you are. Start taking us through some of them. I believe you're following what is called an ATM strategy, where you assess and you triage. Triage is when you do a pre-screening of the person before you decide where to send him or her, and then you transfer to hospitals or not. But I'll let you describe it in your words.
You know, Srinivasan, the last year when I joined in May, things were exactly same what's in many parts of the country today, unfortunately. Like there were dead bodies on the road dividers. hospitals had 2 or 3 people lying on one bed. There were patients on the floor. So that time, one thing which came to my notice was our one single control room was a big failure.
Okay.
Because in the evening, when we get about 1,000, 1,200, 1,500 positive cases, these thousands of phone calls for beds would jam that single control room, and then everybody will start saying that beds are exhausted, there's no bed available. So I demolished, or I scrapped that single control room on the 8th of June, within exact 30 days of my joining, and we created 24 ward rooms, one in each ward of BMC, and these ward rooms, each equipped with 10 doctors, 10 ambulances, 10 medical teams, 10 telephone operators, 30 lines, round the clock in 3 shifts, almost 1,000 doctors on this job, and they're all MBBS intern girls and boys.
Right.
So who are working for the system, they are not regular doctors. So this was a game changer. Now these war rooms, they get a list of almost 10,000, 8,000 or 3,900, which we got yesterday.
Yeah.
And it's split into 24 parts. Early morning, 6 o'clock, we get this list at midnight.
Okay.
At 8 a.m., these 240 dashboards on 24 on each ward start calling these thousands of patients. And we start visiting those patients who need beds. Our ambulances and medical teams reach their home.
Right.
They assess their medical condition.
Right.
They assess their oxygen level, what type category of bed they're entitled to. And then they get in touch with the ward room doctors who have dashboard of 172 hospital with 21,862 beds online.
Okay.
And then the bed is allotted at the residence of the patient, and the same ambulance then carries the patient to the hospital and put him in the bed. Hospitals have no role in allotment of beds. It is all controlled by BMC. So we call it chase the patient policy of BMC since last 1 year or last June. Right from patient's positive report to putting him on the hospital bed, everything is done by BMC. And the positive reports are not shared by labs to the patients.
I see. So
directly.
no hospitals don't allot beds, and people can't just turn up at hospitals. All of this is being done centrally through your control rooms.
And you know, Srinivasan, once we are going with the bed to the patient's home, this 10,000 or 8,000 or 5,000, why should a patient call up the hospital?
Okay.
So this war rooms virtually have been game changers in our fight against COVID.
Okay. This has been a huge help. So as we speak, as of now, Chahal Saab, what is the situation? We can also try and see if we can pull up the current BMC dashboard where you put out all the data on screen. But why don't you just tell us, currently, how many beds do you have? How many are occupied and how many are vacant?
You know, when this wave started, we had 12,000 beds on the dashboard and 1,500 ICU. Now we have almost 21,862 beds on the dashboard with almost 3,000 ICU. We kept on adding the beds, and now we are planning to add 7,000 more in the times to come. Now, in the last 4 days, the vacant beds have gone from 4,000 to 5,200 today morning, which means we are getting less patients now.
4,000 to 5,000
beds have fallen vacant in last 48 hours.
You have 4,000 to 5,000 vacant beds?
Yeah, we had 4,000 vacant beds 3 days back. Today morning, on my live dashboard on my cell phone, it is 5,200.
And how many of these are ICU beds? How many?
ICU beds, we are stressed. Right now, we have only 40 ICU beds which are available. I agree. And I admit that we are under stress for ICU beds. We are trying to add 800 more now in the next 4 weeks.
Okay. So one important, very important aspect in your fight has been this kind of control room, pre-screening, and then doing the allotment of beds. The other is, from what I could gather, that you've managed to create these jumbo facilities.
Yeah.
Right? You've taken over sports complexes and convention centers and so on.
In fact, there are 7 factors which has contributed to this control or arresting the menace of this virus in Mumbai. I would mention, if you permit me, I'll mention them one at a time. Last April, Honorable CM Maharashtra, Honorable Uddhav Thackeray sir, he was the first person to come up with the idea of jumbo hospitals in greenfield hospitals in open grounds. And he said it should not be COVID care centers. It should be hospitals with ICUs, with dialysis beds, all put together. It should be regular hospital. Now we have 9,200 beds functioning in these jumbos with 612 ICU and dozens of dialysis beds functioning. They are proper DCHC hospitals. So this has been a great help to us. We suddenly could add 9,000 hospital beds with oxygen. 70% of these beds are oxygenated beds.
So
and
these jumbo centers have been a huge help. Very quickly, I want to ask you though, how have you managed to get the staff, the medical staff, to man so many jumbo centers?
We did two things. Honorable CM sir made a Facebook appeal last May, June to all retired Army, Navy, Air Force, state government, central government, doctors and paramedicals to come forward as COVID warriors. And in response, we got 536 of them, which we deployed in various hospitals of Mumbai, these jumbos only. Secondly, I was earlier working as Secretary Medical Education in Maharashtra in 2011-12. I knew Maharashtra has something like 55 medical colleges, and with batch of 200 in each medical college, we had almost 11,000 interns who had done their third prof but not got a degree, sitting home in lockdown last May, June. So I made a WhatsApp appeal to them that you are getting a stipend of 11,000 only. I'll give you 50,000 stipend and a free stay in a 5-star hotel with free boarding and lodging. You come and work with us in ward war rooms. We got 1,100 of these young boys and girls from tribal areas. And they have now managed so well. They are the brain behind this backbone of this war room.
So one is now, so one is the war rooms, the municipal war rooms. The second are the jumbo centers. What?
Now third one, our Honorable CM sir conceived the very unique campaign, unique of its kind, My Family, My Responsibility, which in Marathi we call Maje Kutub, Maji Jawabdari. In Hindi we say Mera Parivar, Meri Zimmewari. From 15th September to 15th November, in the 60 days, Mumbai has 35.1 lakh families. Our 15,000 health workers entered 99% of these homes, 99.1% of the homes twice. First time, we went with a pamphlet. We're carrying the 24 ward war room numbers on the back and the do's and don'ts of COVID in marketplace, in office, in malls, in public transportation, in public domain. And then we warned them that if you don't now wear mask in public domain, we're going to fine you. Then second time we again went, we checked the oxygen levels, we checked their temperatures, we took out 51,000 comorbid people and treated them in this campaign. We pasted 45 lakh stickers in Mumbai on taxis, buses, offices, shops, malls. So no mask, no entry.
So there was a kind of doorstep. That's one.
And then Srinivasan, in this campaign, after warning the people, we started fining them 200 rupees per person. And we are the only city who has fined 27 lakh people, collected 54 crore rupees, 2.7 million fines for not wearing masks in public space. And this is the main reason why we didn't go beyond a figure of 11,000 peak in our COVID positives.
Okay. But one question I did have was about the testing, because, I think you have ramped up testing, or you had ramped up testing. But if you look at the testing figures now, so 14th of April, which is about 2 weeks ago, you were doing about 56,000 tests. That has now currently fallen 28,000, 30,000. So testing has fallen quite a bit. Now, could that be a reason? Some might say the numbers are falling because you're testing less.
Srinivasan, Mumbai's testing capacity is about 50,000, and we did touch 56,000 one time, but that led to delays by 2 days, 3 days of test reports coming. Because what is happening that we allowed a lot of corporate houses to do mass testing, where there's hardly any positivity, but they were hogging our lab capacities. So I had a Zoom meeting with 55 lab CEOs about 2 weeks back. I told them that let us focus on symptomatic and people who are giving home samples who are really needed, rather than having a testing on a corporate style of the entire office. That can wait for some time. So there what we did is, we started putting stickers, red and green sticker for symptomatic and asymptomatic home testing. And I told lab CEOs that not even one of this should be delayed by 24 hours. And I said this corporate testing can wait for some time, maybe 2-3 weeks. This was one reason. And because of this, now test reports started coming in 24 hours turnaround time. And we know symptomatic had to wait and deteriorate his health because his test reports were not coming. That got our 56 figure to roughly about 44, 45,000. Only on weekends, Saturday, Sunday, testing does fall down. But if you see from 1st April till today morning, I've done my homework. We did 11.9 lakh tests and the average comes to 44,100.
Okay. So the average is still high even though the tests have started to come down, but you're saying that one of the reasons is because if you test to your full capacity, it will create delays in the testing system. It's not because of the fact that you're deliberately trying to suppress testing and keep the numbers low.
One more point I'd like to add, that whether it is sample size of 40,000 or 50,000 or 60,000, I would give more importance to RT-PCR testing, which we are doing predominantly.
Right.
And second, I would give more importance to positivity. What is the positivity? Whether it doesn't matter whether you have done 50,000 tests or 60,000 tests. If the positive is under control, it is falling down from 31% to 12.5%.
Right.
Then 45,000 or 50,000 really doesn't matter.
Okay.
And last point.
Yes.
Last point is that if we were testing less, it would have led to mortality. Then that means people who really required tests, they are not being tested and they would have been rushing to hospitals and dying because of no testing. If a mortality rate is one of the lowest,
right,
it also speaks volumes that nobody is being missed out.
Okay. I want to ask you about oxygen, because oxygen has become a big problem everywhere, including where I am right now in Delhi. Are you facing a problem of oxygen?
Srinivasan, we are an island in the country where we doesn't have this problem. It did come about 10 days back when we had to shift 158 patients at 1 a.m. in the night from 6 hospitals to jumbos, including 34 on ventilators in ICU, and we could save all of them in the night operation from 1 a.m. to 5 a.m. because oxygen had finished. After the next morning, I raised alarm bells to Government of India and Government of Maharashtra. I said this cannot be tolerated, and these operations, night operations, cannot be done again and again to save human lives.
Right.
We have 21,000 patients in hospitals. Thousands will die if we don't take care of this. After that, the Government of India was kind enough to allocate us 175 metric tons from Reliance in Jamnagar, and things became normal.
So currently, would you say you have an oxygen problem in your hospital?
I can assure you, and you can quote me anywhere, that Mumbai has no oxygen problem now.
Wow. That's incredible. Again, fingers crossed, fingers crossed. Let's hope it stays that way. Vaccinations now.
No, there are 3 more factors which I must mention, which has led to this decline.
Okay. Very quickly run us through them because we're short on time.
You know, I salute my 130 private hospitals in Mumbai, especially 35 big ones. Right from last June, they are giving me 80% beds. They have surrendered the allotment to me, and they are charging 4,000 rupees for a COVID bed.
Okay.
Because of their discipline, we could succeed in this war room operations.
Okay, that's one.
And 2 more points.
Yes.
Is that we are the only one city who have reserved 2,000 suspected category of beds in jumbos, which means if anybody is not tested, because limited testing is there in the country, if he's feeling unwell, he should simply take auto rickshaw, taxi or an ambulance and directly walk into the jumbos. There's walk-in facility.
Okay, so you have actually a suspected category, which is between
we
positive and not positive suspected, which is, I don't think, maybe other places
lives
don't.
in last 1 year through the suspected beds.
Okay.
All oxygenated.
Okay, that's 2. What's the third? You said you had 3. What's the third?
Then the next was I already mentioned our change the patient policy, and the last but not the least,
yes,
the team BMC, the dedication of my team,
right,
which is making all this happen.
Okay, no, it's always important to acknowledge those behind the scenes. Now let me ask you on vaccination. Yes, because we could be heading into some worries there, not just you, everywhere, because May 1st, it opens up fully. This is now going to be the age of 18 and above. Do you have the stock, vaccination stock, to now deal with this additional surge?
Yeah, that's a very valid question you're asking me, and we must address this question. I said I have been telling my team and I'm telling my state government that when you talk of mass vaccination from 1st of May, we have to split this entire issue into 2 parts. One part is the supply chain, and the second part is the actual paraphernalia of vaccination centers, hospitals, and the plan of action, how to materialize mass vaccination. Now, as far as the second part is concerned, we are fully geared up. We have 227 that Nagar Sevak corporator wards in Mumbai. We are opening one government center in each of these 227. Plus, we are adding private hospitals from 70 to now to 150. And we already have 63 municipal centers already working. So we intend to take vaccination centers to 400 plus from existing 132. And we are segregating some centers for 45 plus only and some centers for 18 to 45 to avoid crowding.
Okay. But what about vaccines? Do you have enough vaccines?
First part, as far as availability of vaccine is concerned, the government of India's instructions are very clear that institutions like BMC, they cannot directly procure. They have to depend on the state government. Only state government is empowered to procure vaccinations and give it to institutions like BMC and other corporations. Our state government is working day and night. They're into talks with Serum Institute, who happen to be in our state only, and the Hyderabad Institute. And we are trying to tie up vaccination. It may take time.
That's fair enough. Of course, you can't procure directly. I appreciate that. But we had already seen, even before the opening up, we had already seen vaccine shortages in Mumbai. Is that right? We had, the health minister himself came on and said, and we saw there were vaccine centers were closing all over the city and other parts of Maharashtra. Now,
in fact, this is a fact. The day before yesterday evening at 7 p.m., we got 1.5 lakh stock. Then day before yesterday, 2 days back.
Yes.
So day before yesterday, we did 69,000 record this vaccination in one day. Yesterday, we did 75,000 in one day. Now with this limited centers only. And now we are left with only 4,000 vaccine. What do we do? Today, again, there's a problem in Mumbai.
At the moment, you only have 4,000 doses.
Yes.
For all of Mumbai.
Correct.
And you are averaging about 60 to 70,000.
No, yesterday evening we had the record highest of 75,000 vaccination in one day. We can do 1 lakh per day provided we get the stocks.
So you can do 1 lakh per day, but at the moment you say you have only 4,000 doses.
That's the problem. In fact, with the new kind of expansion which we are doing, we will be able to handle 2 lakh per day also. But provided we are assured of vaccination supply, that is not in my hand, unfortunately.
No, I know it's not in your hand, but that's the big worry, because these vaccine makers are telling state governments that we still have to fulfill our commitments to the center. So we can only start shipping to you perhaps in 2 weeks, 3, perhaps more. So how this additional shortage how this additional demand is going to be met is going to be a big challenge.
I agree with you. But as a BMC commissioner, I am not involved in those discussions between the state government and the central government and the state government and the companies.
Of course, you're not. But I appreciate what you're saying, that currently you're just down to 4,000 doses and you need more doses very soon just to meet the existing requirements and then also to be able to ramp up.
That's right.
So just last word from you. Some of the things you've described, because, I have to confess, sitting in Delhi, which is an absolute nightmare right now for the virus, one almost feels a stab of envy for what's happening in Mumbai, and we, God bless, we hope it stays that way.
Thank you very much.
But you think some of these steps that you've taken, they can be replicated by other cities, can they not?
Srinivasan, I'm a military officer's son. My father was Army colonel. I always believe in discipline. I believe in systems. I believe in systems working on autopilots. Individuals cannot make a difference, but the autopilots must work. Every system in Mumbai, whether ambulance and Uber platform, whether change the virus policy, whether change the patient policy, whether our private hospitals, whether our ward war rooms, they're all on autopilot. Whether we get 5,000 cases or 10,000 cases doesn't matter. So this is the only way to fight this invisible enemy.
Okay. Well, we wish you all the best in the fight. As I said at the outset, the fight is far from over, so there's no scope or space to even rest on one's laurels or get complacent. But fingers crossed that the curve continues to drop in Mumbai. And, thank you very much indeed, Chahal Saab.
Thank you very much. I'm grateful
for coming and sharing, your experience with us. Thanks very much.
Thank you.